G'day, I'm Brad. I'm a men's health pharmacist based in Canberra, but originally I'm from the bush. And I think that that's important because coming from Armidale, I was born on a small farm just out of town, I think gives us the benefit of that colloquialism, the ability to connect with the average Aussie male. And we're all the average Aussie male. So I think that that's important. So that's who I am. I'm a dad of 4, and I'm an enthusiast of camping and the great outdoors. So I'm just like everybody else. So welcome to Men's Health Down Under. Men's Health Down Under was established about 10 years ago here in Canberra, largely because we knew men needed more help with the urological health. Urological health is a really broad range of things that can encompass prostate cancer, erectile dysfunction, Peyronie's disease, where the penis is bent, incontinence, phimosis, where you get a tight foreskin, and a whole range of other bits and pieces. What we were finding was that the GPs were able to diagnose and refer largely to the urologist, and then the urologist, typically in the case of prostate cancer, would do the surgery or refer them on for further treatment, and then the patient was left in this state of limbo where they needed additional support. Pharmacists are a really interesting group of people that had always put labels on boxes, but did have the skill set that enabled them to talk about compliance to medication regimes and using devices, interactions with other medications, use of other medications and the side effects they can have, but also just being there as good people to support patients on what can be a fairly confronting and at times nervous journey, particularly with those things that are so sensitive and that have been taboo for so many years. As a pharmacist, your options are a little limited when you come out of university traditionally. Now that's changing and changed probably a lot over COVID times. So going back in 2013 when this first came about, one of my regular patients, and I'm sure we all know people like this, we've got a dad like this, a patient like this, an uncle like this, one of my regular patients came in and he used to tell the dirty jokes and he said, "Brad, I need a penis pump." And I remember laughing at this gentleman and he chuckled and I said, "Right, pull the other one." And he said, No, I'm not joking." I said, "Oh, okay, we better learn a bit more about this." And we went and sat down in my consult room, and at that point in time it didn't have a door, it was an open roof, and this gentleman told me all about his prostate cancer experience and how his urologist wanted him to use a penis pump, a vacuum erection device. And we both shed a tear. It was quite confronting for me, I knew nothing about it. And as that unfolded, we ended up going in to see his urologist, learn a lot more about prostate cancer and the issues the guys have after surgery, and the short of it is that we ended up importing these penis pumps from all over the world and other things, penile clamps for incontinence, stretching devices for Peyronie's disease and shortened penises, a whole range of stuff that I never knew existed. And I guess it wasn't a lot different to what we were doing in the pharmacy in those days anyway. We were selling blood pressure machines and scales. It was just an extension of that. The other nice piece was that as the medicine experts, we were able to help the guys with the medicines. And often I prescribed a small handful of medications for incontinence, cancer, erectile dysfunction, and so on and so forth. So I guess that's kind of where we started. And today we've got clinics dotted around all over the place in Australia. They typically operate through community pharmacies, which I think is a really nice pairing because you've got that localness of a pharmacist, but also the expert knowledge that they've got to help the patients. Men's Health Down Under started pretty humbly, one pharmacy, one pharmacist, to now today, right now we've got 8 different locations around Australia and in the vicinity of 13 men's health pharmacists. And these pharmacists are not just your stock standard pharmacists. These guys are trained to understand the urological health issues that men have. And I think that that's really important to note. So these are not just your standard going to the pharmacy, "G'day, Brad," pharmacists. These guys have a lot more training and a lot more skills so that they can help these guys a lot more. Interestingly, we're seeing pharmacists, particularly as pharmacy changes, it goes from a more traditional versus discount space, and that's currently where we are, into this desire to do more professional services, to work with more people in their local community, to win in business in other ways. We find that there's a lot more pharmacists that are knocking on our door saying, "How do we get involved?" Not only do we want to build our business, but we want to help these patients because we can see the importance of it. As a result, we tend to take on pharmacists to join our brand. And what I mean by that is that the pharmacists in their local community pharmacy, and they might own the pharmacy or part of it, or they might actually be an employee. They come down to Canberra, we train them up, they spend some time with us, go to the urologist's office, see patients, do the readings, and then they go back to the local pharmacies and they can practice under the Men's Health and under branding. I think that's really important because it brings a certain amount of baseline knowledge so that the patient knows what they're going to get, so that the local practitioner, the urologist, the GP, the physio, the sex therapist, these guys know the level of standard that the patient will get as well. In terms of growing our brand, we're actually next year doing a trip around Australia, so we're going to be out for 6 months, dropping into a bunch of regional and remote communities in Australia and doing evening forums and patient consults the next day at the local pharmacy. So again, trying to get the word out, trying to support these guys. We know that the guys in regional Australia are doing it tough. We've seen that not only through our own clinics, but also through the evidence through the Prostate Cancer Foundation of Australia. These guys are disadvantaged, they need the help. To date, we've seen about 1,000 patients a year through our office here in Canberra. And more widely through our network, the number could be closer to 2,000. Doing the work that we do and working with the patients and the doctors that we work with gives us a great sense of pride. It would be unreasonable to say we're anything other than proud of the work that we do. And we get that feedback from the patients and from the doctors that, hey, great work with Mr. Smith. He gave us the feedback. We're seeing the results from the doctor. Or equally, Mr. Smith gives you a call down the track and says, "You're not going to believe it. We've finally got there. We've accomplished what we set out to achieve." And that reward is reward beyond financial payment. It's reward beyond working in at the pharmacy every day, putting the sticker on the box and talking to the patient about the medication. It's almost undescribable, the sense of reward and recognition that patient and doctor feedback gives us. And it's certainly what makes us keep coming in every day to make sure that we're getting across this stuff. We know that the last couple of years have been tiring and stressful with COVID, with vaccination, with masks, with no travel, no holiday. Workplace burnout's incredible, and it's happening everywhere. And we're seeing pharmacists, doctors, and the allied healthcare team all feeling this pressure of burnout. And I suppose for us in the men's health space, being able to do a couple of days a week on something we're passionate about, almost like a passion project, has given us that chance to reset, do something we really love doing, and help these patients. And it's going to give us longevity in our careers and help us help more patients.